Hi, everybody. I'm back. It's Dr. Natasha Williams here. Great to be back. And I hope you haven't missed me too much. But again, for those who don't remember me, I'm Dr. Natasha Williams. I'm a clinical psychologist, keynote speaker, as well as best-selling author. Thank you so much for meeting me here and joining me on Facebook Live. And today, hot topic, we're going to be talking about anxiety. And I know a lot of people had asked me to talk about anxiety because it's something that they're dealing with in their lives as well. And here's the thing, I deal with it in my life too. So what's important to know is that, our experiences are shared. So what I thought I would do first, as usual, is I give a little bit of a definition, because I think we all need to be on the same page so that we can really understand what anxiety is. Now, here's the thing. Before I even give the definition, understand that everybody gets anxious, which means that anxiety can be normal. So the minute I say anxiety, it doesn't mean that you have a disorder. There are symptoms of clinical anxiety, which would then require attention. But there are points and times in our life where it is normal to be anxious. So if anyone tells you, or if you go to therapy and somebody tells you they're trying to get rid of all of their anxiety, please, and if the therapist says that they can do it, please run the other way, because it is not true. As human beings, anxiety is actually normal to a certain extent. So again, it is normal to feel anxious about things. So say, for example, you are in the midst of buying a new home. There's going to be normal levels of anxiety, nervousness, stress that are going to be associated with that new purchase. Going through the process, signing the contracts, getting the due diligence done, the negotiations back and forth. So that anxiety is going to be normal. Another example would be going for a new job. It absolutely makes sense that you're going to feel nervous, anxious, because you don't necessarily know what you're getting into. But so there's a level of uncertainty, the unknown, which fuels some of that anxiety. So it's okay in these certain circumstances, for example, to have a little bit of anxiety. Now, here's the thing. In these situations, they're warranted. But what happens is that we know that it doesn't impact per se or impede your everyday functioning. So we know that that anxiety is for a specific point in time. You are going to feel uneasy. You are going to feel nervous. And sometimes there's physical symptoms that are connected to it as well. So sometimes you feel lightheaded, nauseous. Sometimes your mouth gets dry. You get a bit of the shakes. Sometimes you sweat a little bit. But in that situation, it makes sense. Hi, Janet. Thank you for joining me. So in those situations, it makes sense, to have those reactions, because sometimes going into the unknown makes us nervous. But it is contained to that specific situation, and it doesn't impact our normal functioning. Now, when we say normal functioning, we're talking about the ability to execute your job function, for example, your ability to be social and hang out with your friends, the ability to engage in your day-to-day activities. So the things like cooking, cleaning, laundry, like, your everyday things. So it's not impacting those types of functions. So again, anxiety is normal. And usually I would say something like this, and just to give you a bit of a definition or a quote, ordinary anxiety comes and goes, but does not interfere with everyday life. So again, studying for a test, if for people that are going back to school, studying for a test or getting ready or prepping for a test, there's going to be levels of normal anxiety that are going to be connected with those types of things. However, now what we want to do is talk a little bit about when we're talking about clinical anxiety. So as a psychologist, I would be able to diagnose a variety of anxiety disorders. So when does it become a disorder? Anxiety becomes a disorder when it starts to impact your everyday functioning. So when I say that, it means that you're having difficulty executing your day-to-day activities. You are not being as social as you used to be. So you're not spending as much time with friends, spending as much time with family, maybe tending to isolate yourself because of those anxious symptoms. Hi, Tasha. Thank you for joining. Otherwise, or sometimes it could be that you're having difficulty functioning at work. So you're going to the job, you're unable to execute your day-to-day activities because the anxiety becomes so overwhelming. So anxiety disorders become debilitating and affect your day-to-day functioning. So this is when we start to differentiate between this is anxiety, which is normal for the event, for the situation, for the unknown, versus this is becoming something clinical. So I'll just take a moment. I'm not going to get into the whole diagnostic criteria for all the anxiety disorders. But what I will mention is that as psychologists, when we use the diagnostic manual, what we do is we have different categories for different types of anxiety disorders. So we've got things such as comes, and usually it comes, again, we call it without provocation, which means there's not really a trigger to this surge of symptoms. And the surge comes again without any certain trigger. And what ends up happening is that you end up getting a flood of all of these symptoms. It could be a headache, it can be nausea, it can be dry mouth, it can be restlessness. So just being uneasy, you can't stay still. Tightness in the throat. Again, I think I mentioned nausea, sometimes excessive sweating, heart beating and racing really fast, dizziness, I think if I haven't mentioned that. So all of these symptoms come as sort of like a flood, and they're difficult to control. And a lot of times people feel that they are going to die. I can't catch my breath. I don't know what to do. I think I'm going to die. So in those circumstances, if we notice that someone is having those types of symptoms frequently, and this could be on a daily basis or whatever, and medical issues have been ruled out, which means that you've got a medical workup done. Sometimes the medical doctor will do a stress test to see if there are any issues with the heart. And if all of those things are ruled out, we can safely say that this is anxiety, and this is what we're looking at as possibly a panic disorder, okay? We have other types of anxiety which are classified as phobias. So these are fears of certain things. I know in my practice, for example, I see a lot of vehicular phobias or driving anxiety, to say it a bit straighter. And in that, literally, somebody has been in a car accident and they refuse to get back into a car again. So they refuse to drive because they are so fearful of getting in another accident. Or if they do drive, they drive with such fear that it makes them so uncomfortable. And if it's not a driver, sometimes if the person that was in an accident was the passenger, then they have in-vehicle passenger anxiety, which means that they have significant difficulty being in a vehicle for fear of being in another accident. And a lot of times we see symptoms such as bracing. So they're, bracing or holding on to the bar at the top. We have another symptom called a phantom brake. So they are literally, believing that they can stop the car, but they're the passenger. Hypervigilance, which means they're always looking around, looking to see their surroundings, or sometimes they're coaching the driver. So they believe that if they tell the driver, watch out, watch where you're going, look, did you see that car is too close? Then what happens is they believe that they can increase their safety. So that's an example of a phobia, but there's other types of phobias as well, which are also classified as anxiety. Some people talk about fear of snakes, fear of other animals, fear of a variety of things. We also have social anxiety. So these are individuals that have difficulty in social settings. And it's not because that they're introverted, but they really feel, well, almost like what we call an agoraphobia. And that basically means that they have difficulty in places where they feel that there's not going to be any escape. So they don't like social settings. They won't go into places like malls or larger crowds. They would prefer to isolate themselves. And in the midst of that, what happens is that this starts to impede regular functioning. So for somebody that's socially anxious, for example, this may cause them not to be able to go to the grocery store, which means now they're not able to do their grocery shopping or get the foods that they need. And sometimes what they'll do is they'll use compensatory measures. So a lot of times you'll have people say, well, I use grocerygateway.com or another delivery service, so I don't have to go to the grocery store anymore. But what's very interesting with anxiety, avoidance fuels anxiety. So the more that you avoid what it is that you're fearful of, the stronger the anxiety becomes. So the more somebody who is socially anxious avoids social situations, the stronger those symptoms are going to be. So as a psychologist, when I'm starting to treat a patient with an anxiety disorder, for example, we have to start to educate the individual that unfortunately it's the exposure to what you are fearing that actually will extinguish or decrease the intensity of the anxiety. And a lot of people will sit there and say, oh no, absolutely not. I'm already too scared of this. How am I supposed to, face it? And I said, well, unfortunately, it's that sense of discomfort, but also being able to understand that within your own efficacy, that you're going to be able to have the coping strategies that you need to deal with the situation that actually ends up being a better teacher. So that's just a little bit of an example. We also have what we call obsessive compulsive disorders, or the short form OCD. So again, symptoms of, obsessing. The obsessions are the thoughts that are going over and over in your head. The compulsions are what helps to ease the obsessions. So a lot of times if you have somebody, for example, that has to check their door over and over and over again before they leave the home, a lot of it is that they've had this thought of, have I checked the door? Have I checked the door? Have I checked the door? And what happens is that, for example, if this is somebody that's trying to get to work, what ends up happening is that they get to work later and later and later. It's impeding their ability to actually function and get to work, because that obsession and the subsequent compulsion has to be done for the anxiety to be reduced, as an example. We also have other things such as separation anxiety. So a lot of times you'll see that in children, and I won't get into that too much. But again, it sort of speaks for itself. Having the difficulty being able to separate from another person, end up being very either clingy or whatever the case may be. We also have an anxiety which used to be called, it's like a health anxiety, or hypochondriasis, hypochondriac. So somebody that is always so concerned about their health. Sometimes they're doctor shopping, going to several doctors. Every little thing that is happening to them, they end up catastrophizing that situation. So you have that type of anxiety as well. Now, the other anxiety that we talk about quite a bit, however, it's not, it's no longer seen as an anxiety, as part of the anxiety disorders. As of the DSM-5, and not to get into too much detail, it's seen as its own category, is post-traumatic stress disorder. So literally, it's about being involved in a significant trauma, which then impedes your normal functioning. We look for symptoms such as having nightmares or bad dreams. We look at having flashbacks of that incident, or persistent thoughts of that incident. And from there, there's a myriad of other symptoms that the person has. Usually their affect or the way that they feel is very flat, very low. There's no range of emotions with this individual. You're going to have difficulty with concentration and focus and those kinds of things. So that's also a separate category as well. But at the same time, it is also, anxiety. It also has anxiety wrapped into it. Okay, so again, I did not want to get into too many of the diagnostic pieces, but I thought that would at least give a little bit of a framework to understand anxiety a little bit. So, and I know we don't have a lot of time, so this is really just a brief touch of anxiety and what that looks like. So if you're starting to notice that you're feeling overwhelmed, or if we're looking at, for example, general anxiety disorder, where you're just feeling anxious about everything and noticing that you're worrying about everything. So sorry, I forgot to mention about generalized anxiety disorder, where you worry excessively about everything. A lot of times what happens with these individuals is that what we call the worst case scenario. And what do I mean by that? When we talk about the worst case scenario, you as an individual, when you're becoming clinically anxious, you're trying to prepare for what you believe is the worst possible outcome in that situation. So this means, for example, if somebody believes that they're going to go do a speech or something like that, and they believe that everybody in the audience is going to believe that they are silly or stupid, that they're not intelligent enough to be on that stage. A lot of people, what happens is that their anxiety takes over and they'll over prepare, or they will, not sleep the night before because they have to be prepared. I had one client, for example, who would have a meeting every Monday, and they would have to speak in front of the team. And for him, he would have to take medication. In his case, it was an Ativan, just to calm him down enough to be able to present. But a lot of what was going on in his frame of mind and his frame of reference was, the worst thing that could possibly happen is that the rest of my team is going to find me out. They're going to know that I don't deserve to be in this position. So what happens is that the body ends up preparing for what we believe is the worst case scenario. Now, here's the thing. When we are starting to prepare for this worst case scenario, we already believe that we don't have the coping mechanisms to deal with that worst case scenario. So what happens is we get all riled up, all worked up, and then a lot of times that's where the avoidance kicks in. If I can avoid the situation, then the worst case scenario won't happen and I'll be okay. So that's where a lot of the issues come from. So as a psychologist, what I aim to do with some of my clients is we'll start to look at what we call cognitive behavioral therapy interventions to actually start to address some of these mindsets that we're seeing with someone who is dealing with anxiety. And here's the thing. There are a lot of things and a couple of tips I'm going to leave with you that you can also do as well to start to identify and deal with that anxiety. So if I leave you with just a few things, to identify if the anxiety is becoming a significant problem, I would love for you to see how the anxiety is impacting your day-to-day life. Are there things that you are avoiding that you maybe didn't avoid before, but you notice that it is really causing or impacting your day-to-day function? So for example, are you avoiding driving because you're afraid of getting back in a vehicle, but instead you decide, I'm going to just take the bus? But what this does, this adds hours to your commute while your vehicle is still sitting in the driveway. Or are you having increased difficulty getting to work? Hi, Michael. Thank you again for joining us. Are you having increased difficulty getting to work? So Are you experiencing symptoms of anxiety in which you're having difficulty getting to work? So checking the door over and over again, for example. Or is it impacting your performance at work? So if you're at work, but you're having difficulty with focus, difficulty with concentration, being unable to just execute your stuff because you're just foggy or you're restless, you can't sit still. These are some of the things you want to look out for if you're starting to look at the anxiety being a problem. The other thing you really want to look for is how is it impacting your recreational activities and your social activities? Do you find that you're becoming more recluse, that you're actually staying at home and you're staying at home more and you're not engaging with people as much as you used to because of your anxiety or because of your nervousness? Do you find that you don't contact people as much as you used to? Or you're not engaging in your recreational activities as much as you used to as well? These are going to be some of the signs that your anxiety is actually a problem that has to be addressed. Now, here's the other thing. I talked about depression in one of my previous lives. And here's the other thing. A lot of these symptoms mirror each other, or they marry with each other, I'm sorry. So that's also a very interesting thing. A lot of times the comorbidity of anxiety and depression is very real. So you'll see symptoms of anxiety and symptoms of depression all muddled in together. Most importantly, what you really want to understand is how is it impacting your day-to-day function. If, for example, you notice that your day-to-day functioning is being impacted, so for example, you're unable to engage in your what we call activities of daily living. So bathing, dressing, doing things around the home, cleaning, cooking, because you are so anxious, then you know that at this point that it's impacting your day-to-day function, and we have to really start looking at some interventions to really try and understand how to cope and deal with the anxiety. And here's the other thing. There is no shame in anxiety. There's no shame in reaching out and saying that, you know what, this is beyond me and I may need some help. Some people may not understand, and that's fine. Those will not be the people that you would reach out to. But there is no shame in saying, you know what, this is beyond me and I'm going to really need some help. So that's going to be very, very important. So we can start looking at, for example, trying to look for a professional who can actually allow you to get some of the therapy or strategies that you would need to start dealing with depression, and sorry, with anxiety. And the interesting thing is that, again, a lot of times it is the exposure to the anxious situation that helps to reduce the intensity of it. A lot of times I look at it as a cycle. So the more that you avoid is the stronger the anxiety becomes. So exposure actually breaks that cycle and it actually teaches the individual that they're able to cope in the midst of uncertainty. A lot of times the fear of uncertainty causes a lot of the anxiety as well. But again, we can go into another complete Facebook Live about the fear of uncertainty, the fear of failure, how that fuels a lot of anxiety. So that piece is also important as well. The other tips I'd actually love to leave with you as well that I think are also going to be important are some just natural things that we can do as individuals to start to mitigate some of these symptoms of anxiety. So a lot of times the simple things such as getting enough sleep. The more tired you become, a lot of times the more restless you become, the more that the thoughts in your head start to ruminate and start to, percolate in your mind. And a lot of times that's fueled by lack of sleep as well. So that's one thing we would really have to start looking at as one strategy to start to deal with anxiety. Activity and exercise. A lot of times with anxiety also comes lethargy. So being able to channel some of that energy into activity. Now, I'm not talking about running a marathon or anything of that nature, but what I'm just saying is that it's important to move. And that also might be something that will be helpful as well. Avoiding alcohol. Now, I know this is going to be a big one for some people, but a lot of times when you are feeling anxious, actually consuming alcohol actually intensifies the symptoms of anxiety. So what I would look at, and then some people actually use alcohol to cope with their anxious symptoms. So it's now also important to look at limiting your alcohol intake and also limiting your caffeine intake. We have a lot of people that will drink a lot of coffee, and the caffeine is a stimulant. So if you're already anxious, having that excessive caffeine as a stimulant also will not be helpful with symptoms of anxiety. So those are going to be a few tips that I would leave with you in regards to how to start coping with anxiety. I know this has been a short time that we've been together, but my hope is that, just by opening up the dialogue and opening up the conversation a little bit in regards to anxiety would allow you to feel comfortable enough to say, you know what, this may be something that I may have to deal with, or it might be impacting my ability to get to where I want to go. So if you find that this has been helpful for you, I would love to hear from you. I would ask you to come to my website. My website is drnatashawilliams.com. Visit me on my website. I actually have a worksheet which is called the Miracle Question. And it sort of is a free resource that I have for anyone who comes on my website. Just provide me with your email address, and I'll be sure that it'll be sent to you. And what this worksheet does, it allows you to start targeting some of the issues that might be related to what might be impacting your ability to move forward. And anxiety, a lot of times, is one of those big things that impacts somebody's ability to move forward in their purpose and to fulfill their dreams. So I would invite you to come on my website. Again, www.drnatashawilliams.com. Check out the worksheet. I'd love you to tune in next week, Eastern Standard Time, 7 p.m. We're going to be doing a 2-part series on vulnerability. So again, thank you for joining me on Facebook Live. I will see you next week, Eastern Standard Time at 7 p.m., where we'll talk about vulnerability. Have a good evening.